Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. For many people, a medical imaging appointment is a routine part of healthcare. Whether you're having an X-ray CT scan, MRI, ultrasound, mammogram, or nuclear medicine examination, your imaging team is working to make the process as safe, efficient, and accurate as possible. But every day, appointments are delayed or occasionally need to be rescheduled because of simple, preventable issues. Most of these aren't major mistakes, and they certainly aren't something to feel embarrassed about. They usually happen because preparation instructions can vary depending on the examination, and patients may not realize that what applies to one type of scan may not apply to another. Today, we're looking at 7 common issues that can delay a medical imaging examination, and more importantly, how you can help your appointment go as smoothly as possible. One of the biggest misconceptions about medical imaging is that every examination is prepared the same way. In reality, every type of imaging has its own purpose, its own technology, and sometimes its own preparation requirements. Some examinations require fasting. Others encourage you to drink water beforehand. Certain MRI examinations may require detailed safety screening. Some nuclear medicine procedures involve preparation that begins hours or even days before your appointment. Many X-rays require very little preparation at all. That's why it's so important to read the instructions provided by your healthcare team rather than relying on advice from friends, family, or previous imaging experiences. Even 2 CT scans performed on different parts of the body may have completely different preparation requirements. The first and probably most common issue is simply not reading the preparation instructions before arriving for your appointment. It's understandable. Life gets busy, appointment notifications can be overlooked, and many people assume that every imaging exam follows the same routine. But those instructions are provided for a reason. Depending on the examination, they may include information about eating and drinking, medications, clothing, arrival times, or other important preparation steps. Following those instructions helps the imaging team perform your examination as safely and effectively as possible. If anything in the instructions is unclear, don't guess. Contact the imaging department before your appointment. The staff would much rather answer a question ahead of time than discover a preventable issue after you've already arrived. Taking just a few minutes to review your preparation instructions can save time, reduce stress, and help your appointment stay on schedule. Our second common issue is arriving late, or even arriving exactly at your appointment time. Many people assume their appointment begins the moment they're scheduled to enter the imaging room. In reality, there are often several important steps that happen before your examination even begins. Depending on the type of imaging, you may need to register, complete safety questionnaires, change into a gown, review your medical history, or have an IV started if contrast is required. Some departments also need time to verify your identity, review your requisition, and prepare specialized equipment or medications before your scan. Even arriving just a few minutes late can sometimes create challenges, especially if the department has a full schedule. Whenever possible, plan to arrive 15 to 30 minutes before your scheduled appointment, or follow the arrival time provided in your appointment instructions. Giving yourself a little extra time can reduce stress, allow for unexpected delays like traffic or parking, and help keep both your appointment and the appointments of other patients running smoothly. Another common reason for delays is clothing or personal items that may interfere with certain imaging examinations. Many patients aren't aware that metal objects, including jewelry, belts, watches, hair accessories, hearing aids, removable dental appliances, and even some clothing fasteners, may need to be removed depending on the examination. For MRI, additional screening is required because the powerful magnetic field interacts with certain metallic and electronic items. For other imaging examinations, metal objects can sometimes create image artifacts that obscure important anatomy. Every examination is different, which is why your technologist will explain exactly what needs to be removed and what can safely remain in place. If you're unsure what to wear Comfortable clothing without metal fasteners is often helpful, but always follow the instructions provided for your specific examination. And remember, if you do arrive wearing clothing that isn't suitable, don't worry. Many departments can provide a hospital gown when needed. The goal isn't convenience. It's obtaining the best possible images while maintaining patient safety. The fourth issue is one that many patients don't realize is important: forgetting to mention medical information that could affect the examination. Before some imaging studies, your technologist may ask about previous surgeries, implanted medical devices, allergies, medications, kidney disease, diabetes, or the possibility of pregnancy when appropriate. These questions aren't simply routine paperwork. They're an important part of planning your examination safely. For example, knowing about certain implanted medical devices can influence MRI safety screening. Information about previous surgeries may help explain expected imaging findings. Medication history and kidney function may also be considered before certain contrast-enhanced examinations, depending on the clinical situation. If you have an implant identification card or a current medication list, bringing it with you can sometimes make this process easier. And if you're ever unsure whether something is relevant, mention it. Your imaging team would much rather have more information than not enough. These conversations help ensure your examination is tailored to your individual needs and performed as safely as possible. The fifth mistake is one that's incredibly easy to avoid: not asking questions. Many patients worry that they'll slow things down or ask the wrong question. The truth is, your imaging team wants you to understand what's happening. If you're unsure whether you should eat before your appointment, take your medications, drink water, wear certain clothing, or bring anything with you, ask. If you're nervous about the examination itself, let your technologist know. They perform these examinations every day and are there to guide you through the process. Clear communication before your examination often leads to a smoother experience, less anxiety, and better images. Remember, there are no silly questions when it comes to your healthcare. Once your examination begins, your technologist may ask you to hold still, change positions, raise your arms, hold your breath for a few seconds, or follow other simple instructions. These instructions aren't arbitrary. They're designed to help produce the clearest diagnostic images possible. Even small movements can reduce image quality during certain examinations, while proper positioning allows the anatomy of interest to be seen more clearly. If you're uncomfortable or unable to maintain a position because of pain or another medical condition, tell your technologist. They can often modify the examination or work with you to find the safest and most comfortable approach. The goal isn't perfection. The goal is obtaining diagnostic images while keeping you safe and comfortable throughout the examination. Our final point isn't really a mistake. It's a common misunderstanding. Sometimes appointments run behind schedule. When that happens, many patients naturally worry that something has gone wrong. In reality, imaging departments are dynamic environments. Emergency patients may require immediate imaging. Some examinations are more complex than expected. Patients occasionally need additional assistance, extra images, or more time because of their medical condition. Every day is different. Your imaging team works hard to keep appointments on schedule while also responding to urgent patient needs throughout the hospital. If your appointment is delayed, it's rarely because of anything you've done. It's simply part of providing care in a busy healthcare environment where patient needs can change unexpectedly. Your patience and understanding are greatly appreciated by the healthcare professionals working behind the scenes. Let's finish with 5 simple ways to help your appointment go as smoothly as possible. First, read your preparation instructions a day or two before your appointment. Second, arrive early enough to complete any required registration or screening. Third, bring any important medical information requested by your healthcare team. Fourth, ask questions if anything is unclear. And finally, follow your technologist's instructions during the examination and let them know if you're uncomfortable or unable to do something. These small steps help your imaging team provide safe, efficient, and high-quality care. Preparing for a medical imaging examination doesn't have to be stressful. Most appointments go exactly as planned, and your imaging team is there to help guide you every step of the way. By understanding a few simple preparation tips, asking questions when you're unsure, and working together with your healthcare team, you can help your appointment run as smoothly as possible while ensuring the best images for your care. Thank you for watching in the No Medical Imaging, where we make medical imaging easy to understand. If you found this video helpful, please like, subscribe, and share it with someone who has an upcoming medical imaging appointment. And if there's another medical imaging topic you'd like us to explain, let us know in the comments below. Thanks for watching, and we'll see you in the next video.